Welcome back to Crush Medical. We've got another high yield ethics and professional type of question. Make sure to like and subscribe if you find this video helpful. Let's just jump right into it. So we've got a second year resident who is asked by an attending to cover an ED shift alone for a few hours while the attending leaves for an off-site meeting. The attending says she is reachable by text, but no other supervising physician will be present. The resident knows this conflict with hospital policy and may compromise patient safety. What is the most appropriate next step, right? So let's just quickly unpack this. So a second year resident is being asked to do something that they shouldn't be doing, right? And the resident is aware that this also conflicts with hospital policy and ultimately can compromise patient safety, right? So picture you're that resident who is now being asked to do this, and you have no senior staff, you're on your own, and essentially your attending is off to a meeting, right? So let's see what the options are one by one and see which one is the best, okay? And let's start from A. So tell the attending she can return if a serious patient arrives. So that is a really interesting thing. Basically saying, hey, supervising physician, you are on standby. If I need help, please be there for me. So in this case, it would be incorrect, right? And the reason why is because this still leaves the resident in an unsafe, unsupervised role. Extremely important, right? Acuity can change instantly in the emergency department, right? So 9 out of 10 times the patient that comes in the emergency department might be non-emergent, but that one patient who comes through who's maybe a cardiac patient, that's on you now. So in that case, you having that supervision really is important, and that is where it really truly matters, right? So therefore option A is just incorrect here, okay? Option B, so agree to cover because the nursing staff can escalate concerns. So this is really interesting because you're actually giving credit to the nursing staff in the emergency department who are usually on top of all their tasks. And in this context, like if you need that support, they would be there for you. But does that mean they can ultimately make medical decisions and provide you leadership as a resident? That's just not correct, right? So nurses are essential team members, but they do not replace the required physician supervision. So simply just having your attending physician walk out and relying on nursing staff is just not effective, okay? So therefore B is also incorrect. Moving on to option C, so contact department or hospital leadership about the unsafe supervision. So this is interesting, right? So now, firstly, we kind of quickly acknowledge that the resident knows that what he's being asked to do is against hospital policy and is going to compromise patient safety. Option C is essentially saying pick up the phone and call the department and just let them know that your attending put you in this place, and you're essentially telling on him. So in this case, this is actually the correct answer, right? So let's see why. Appropriate ED supervision is required. An unsafe coverage plan should be escalated through the proper chain of command, right? So essentially, if your attending physician is not there, whoever is more senior or the next higher up, it's usually the chairman or medical director, like if this is somebody who you'd have to reach out to and notify that, hey, the attending has left me all alone here and I need support because you can't work unsupervised, and especially not in an emergency department, right? So the point here is, number one, emphasize the idea that supervision is missing. Number two, escalating it, so notifying the department that, hey, we need some leadership present in the clinic or in the emergency. And number three, it's not something that you can just leave, brush under the rug, right? It's something that needs to be addressed. In this context, as soon as this happens, you right away pick up the phone and just mention to whatever leadership support you have that this is what the concern is. And basically what that means is you're not notifying anyone. Like you are essentially addressing it to the point that people have been notified that you are in a place where you shouldn't be, right? So that's really important, okay? And therefore C is the correct answer here. Moving on to option D, so discuss the concern only with other residents after the shift. So this is just flat out incorrect, right? Discussing the concern after the shift does not address the concern, the fact that you are working unsupervised and the fact that you don't have supports in place. So it's just not a good solution here, okay? And again, so addressing this after does not fix the immediate need for the patient safety, and that's the number one thing, right? Always prioritize patient safety above all. Okay. And then ultimately option E, so cover the shift and file a quality improvement report later. So they're basically saying do what is against legal policy and talk about it later. And that's just flat out incorrect. Again, for board purposes, any legal concerns like this, where you are being asked to do something you are never done before, or in this case, like unsupervised shift, always take the high road and notify management, notify the medical director, notify leadership. You can't always, and that will always be the correct answer, right? Whether it's this type of ethics scenario or something similar. Um, and hopefully we'll get into more questions that are similar like this, and we'll see you in the next video, okay?